I'm Sylvia Gordon.
And I'm Rebecca Gordon.
We are the sisters of selling. Let's talk about the ACA Family Glitch.
So it's interesting because if you are employed by an employer, you are not eligible to, or your family's not eligible to go off into the private individual market to get a subsidy. And that's a huge hole for a lot of families because with a lot of employers, they're going to pay X amount for the employee's health care.
Right. We might pay 90% of your,
but not for the family. And for a lot of families, I mean, the cost of health care is still out of reach.
So even though they're eligible for family coverage, they can't afford it.
They can't afford it.
They go without.
So there's the glitch. So what they are trying to do and are working diligently for this next enrollment starting in November for the ACA, so would take effect 2023, is to look at the overall income as well as the cost of the health care from the employer side. And if it's out of whack, those people, and they'll have their own set of guidelines and parameters. If they hit that, they can go into the individual market and get a subsidy. And I mean, we've been talking this ever since the inception of ACA because a group premium is high. It is so high. And I can't speak for huge corporations, how much they pay for the dependents, but historically on groups of 50 and below, again, the employer pays a portion because they have to of the employee, nothing for the family. So back in the good old major medical days, we would carve out the family, throw them on their own individual policy, and leave the one person on the group. So this is a good thing if this happens, and I think it will because I know Biden and Harris have, they're very committed to getting more people in the ACA, and actually they're saying like it's at an all-time high for enrollment into the Affordable Care Act. So this would be really good for the individual market. And we're constantly seeing, or we saw last year, like United Healthcare got into the individual ACA market, and I'm feeling pretty good that they had a very strong year, which they did. And whenever a carrier has a strong year, what do? Expand. So this is just a really good time for that market. We could have a big dump in of individual people from a group plan, a family, into the individual market, and we have more carriers now than ever on more of a national basis in the ACA market. And thank you, Jesus, they're all paying commissions.
Right.
So
it's worth it if you turn your back on that market to look at it again.
Come back.
I did get some calls from agents saying, hey, I'm getting these letters from United Healthcare asking me if I want to go to work and be an ICA in their direct career channel. What is that? And I said, I called them and I said, what? Are you soliciting our independent agents to go work for you? And they said, no, that's a glitch. That should only go on to agents that are not currently contracted with United Healthcare. So if any of your agents, if you run an agency and they have gotten a letter, please call us, let us know. Because we think it was just a glitch, nothing to worry about. Boom, ba-dum-bum. Okay. Let's talk about, want to give a shout out to Centene for putting a woman at the helm.
Yay!
Girl boss. Woo! She was previously at Optum. She's been with Centene in the capacity as a technology officer.
So that's interesting because that's her vision in reimagining the Centene WellCare.
Their company, their vision
is, she wants to really be a technology company that does healthcare. And that's where all of the sauce is in the technology and the crunching the data.
And most of you aren't aware that Centene is huge. You're like, it's this little company that bought WellCare. No, you knew WellCare because you're in Medicare, but Centene is the largest provider of Medicaid. So they're big in Medicaid, and now they've doubled their footprint in Medicare. WellCare's had 2 strong years.
Yeah.
And with the woman at the top,
watch out.
Who knows what's going to happen? Okay, I want to talk about Nancy's problem.
Yeah, this is a weird situation. One of our best favorite longtime friend agents came to us with something really unique where a client, he had cancer, went to the hospital.
He went to the ER.
I'm going to let you just go ahead and tell the story.
Okay, so he went to the ER because he was having problems breathing. He was already a cancer patient, blah, blah, blah. They stabilized him. They admitted him. And on day 2,
they did the COVID test.
Day 2, after he was admitted, they did the COVID test. This is a very big point. they were supposed to do it. They're supposed to do it when they
first get there.
Check you in, right?
Yeah.
He was COVID positive. Okay, so as far as his healthcare, it doesn't really mean anything. His COVID wasn't bad. He's stabilized. He's out. The thing that is the problem for the client and the agent is that if the hospital would have followed their protocol, they're supposed to do a COVID test in the ER. If they would have, a COVID modifier would have been added to the bill, and the insurance company would not have had to pay the bill.
Now you take that big bill around the cancer,
and it's like $5,000,
and is gonna get shifted.
It's like $5,000. So the hospital sent it to the insurance company. The insurance company said, "We're not paying it. You didn't do your job right. If you would have done your job under current federal rules," and again, this was like 8 months ago, we wouldn't have had to pay it.
So it's just for that visit. It has nothing to do with the whole pre-existing cancer.
No.
It's that visit of going to the ER, being admitted.
What the feds had set up at that point, if they had COVID, if you had COVID, your care was covered.
So the problem is,
the hospital didn't do their job. So the hospital said, insurance company's got to pay. Insurance company said no.
We don't have to
So
pay.
then hospital sending the bill to the client for 6 months and harassing the client, saying your insurance won't pay, therefore you have to pay. Therefore, the client is going to the agent, going to Nancy, and saying, "You sold me the plan. Why won't the insurance company pay? Why do I have to pay $5,000?"
It is pathetic, because here's a client who already has cancer, for God's sakes.
Right.
Has no control over any of these rules and is 100% in the middle, just getting batted around like a cat.
Right. So I'm not giving you a solution. I'm just warning you of another
now,
problem.
Is this COVID modifier, is it over? Is it still on?
I don't know. Nobody knows what's going on with this COVID stuff. Is the COVID SEP still on?
Hey, I'll tell you
tells
this.
You something
You
different.
don't have to wear a mask on airplanes now.
So far. That's today. Who knows about tomorrow?
I sleep with my mouth wide
Who knows
open.
about tomorrow? Let's talk about the robocalls just briefly. I got that robot here because I get those constantly.
Oh my God,
Everybody gets them. And the FTC gave out their largest fine. It's $225 million to a Texas company that gave robocalls. Most of the ones that they were calling me, they were all based in Canada. I'm sure that was by design too. But I mean, there's some. It's you put your finger in a hole, whatever. But I will say, don't give up. Don't give up when people are breaking laws. Keep reporting them. When they get enough complaints, eventually our government does something. Yeah, maybe it took 6 years. But they will, so keep complaining.
And they go in waves. It seems like I'll get the 409s. So 317-409, that's always a robo.
Right. If I see my area code,
and I'll get a whole bunch. And a lot of them is they're going to erase my school loan.
Well, I have one on my phone right now.
I graduated in 94. I don't have a school
I've never
loan.
had a loan, right.
Or the IRS is coming after me and I'm going to get arrested if I don't do something. That's my favorite.
Right. But again, this is great content for you to give out to your clients in your social media. If you don't avail yourself to our newsletter, we don't charge you. We put together a comprehensive newsletter that goes to Medicare clients. It goes out quarterly. We have a lot of people that take advantage of that. Do your own and use the information we're giving you on our broadcast.
If
or
you're
sign up for it.
If
Call
you're
your
listening our content, you're listening to it because you're getting something out of it.
Your clients want it too.
Your clients want it too.
Thanks for watching. If you do not subscribe, hit the subscribe button. We're very close to 7,000. We need your finger on the subscribe button. That's all we're asking. A lot of you that watch are our competitors, so we're not asking for anything back. We don't paywall this. We don't firewall it. We could. We're giving it out for free to help everybody build their career. All we ask for is a little click on the subscribe.
Good selling, folks.